one or two questions, sir. It
Yes,
would be
please.
interesting for me to know that, because I know that you use a lot of lesser known remedies, like smaller
Mm-hmm.
remedies, whether in
Mm-hmm.
cases of uremia, cases like uremia remedies like solidago, tribolus terrestris,
Mm-hmm.
and remedies in that direction, urea, for example, and
Yes,
also
yes.
in cases of you spoke about thyroid, cases,
Mm.
different type of smaller remedies, fucus vesiculosis, for example. So can you
Yes.
tell a little bit about this lesser known smaller remedies? How do you how does our these are all our colleagues here? How do they study them? How do they formulate? How do they go in depth, understand that, apply that? How do they begin those studies of the smaller remedy? Can you show them a path?
Yes. Can I extend for 10 minutes more?
Can extend
Gaurang,
for
you have actually
longer.
stimulated me on subject which I
Please,
love. Can
please share.
I?
It will be interesting because
Okay.
for our friends, it would be really, really a new kind of
Just
additional.
1 minute. I'll get the folder so that I can.
Just offhand, if you can share, it's you don't
Yes,
have
yes,
to
it's there with me. It's there with me.
give a
But it will
structure.
be interesting because this is something which I love to doing it systematically.
Sure.
Okay, Dr. Gaurang, I'm showing you a remedy. Very just I found it, so I'm showing you a case of migraine treated with scutellarian, and then the remedy the way I study it. Okay.
Yeah. You can directly go to the way you study it so that we can keep
Yeah.
it for more questions. That's the reason.
Can you see this screen?
No, not
Not
yet. Not yet.
Can you now?
yes,
Yeah.
sir. This
I have labeled this series as Understanding Boring Between the Lines, where I have done many, many remedies on this understanding by the cases which I have solved. Okay. So this is just one case that appeared in front of me. I'm showing it to you. It was a case of migraine. Okay. A chief complaint was a 34-year-old lady. She called in with the complaint of extreme pain due to migraine, and she had been suffering from it for 2 days along with fever. It all started after a family episode of influenza, and she had been mentally and physically exhausted looking at them. She was very tired looking at these family people, and then she got into this migraine. She had to hurry between her daily chores and going to the market and managing things on her own, which got her exposed to sun. And this was a time when she got her menses too, and that was very, very unbearable to her. Understanding of the case, location in different parts of the head, mostly on the right eye, over the parietal region, sensation, sometimes pressing, sometimes cutting, ailments from exposure to sun, heated rooms, on being heated with exertion, physiological pressure of hurry, watching lit screens for a long time, onset of menses. These were the modalities that was by, by noise, jar, which is typical, lying down in dark room made her feel better. She said the headache is excruciating, like a torture. occasionally worsens, then subsides a bit. Mental state, it feels that the pain is so severe that I feel sometimes it is good to die. There is nothing forward to look up to. This lady is a doctor herself. Huh? She is a homeopath only, very senior homeopath. So, see, by this time I had come to the remedy, okay?
Yeah.
So, I just asked questions for confirmation. So, I
Mhm.
knew what she was. So, I asked her, is there any eye symptom? See, Gaurang, you may know how our OPDs are. Generally, it's very fast and you have to prescribe any moment. So, these are my questions direct to her. Do you have any eye symptoms? She says, both eyeballs are paining a lot. So, how's your sleep? Restful or restless? She says, restless. I said, any dreams? She has horrible, unpleasant dreams. Frightful things happen, and then there's dog trying to throw a puppy from a height. I want to rescue it. There's a lot of fear and horror. So by this time, I knew what the remedy was. So what was predominant was the mental anxiety that she had, all her fears, right-sidedness, all started since influenza, and everything appears to be a nervous phenomenon. So I gave her Teleria, 1 m, one dose, 3 times a day. I told her to repeat only when she needs it. She's a homeopath, so I told her you take it whenever you want it. Next day, she's saying I am fighting fit.
Yeah.
So let's understand what sclerotilaria is. The common name, skull cap, the order Libiati.
I'll just quickly tell you what we normally use Scutularia for
Yeah.
our practice, so that you can add, like, directly your experience. Scutularia, sir, generally we are using more and more. Clark gives a very nice description that generally post flu, all symptoms post flu where they cannot fix their attention is the
Hmm.
keynote. He'll writes it in his Materia Medica that, for example, a person who's a lawyer, he's into he's into his legal work, and he gets a flu, he gets a influenza, and after that he just can't go to work, he just can't focus, he just can't have a concentration. So even post COVID, many cases who are not able to focus, not able
Hmm.
to concentrate, and typically is one of the indication where we gave. And of course, the keynote of scutularia is also known as a school teacher's headache. They call, like how
Yes, yes, yes,
yeah,
yes.
how we have students headache, calcarea pause, and all these. So school teachers headache generally. These two, three are the keynotes that, of course, what I remember back of my head, whatever little bit I know. So how would now
Now
you
you see how I do it ahead.
yeah,
It's
would
a
be nice.
medicinal herb that has been used in traditional medicine as for various purposes like sedatives, anti-inflammatory, and antispasmodics. Okay. So the potential toxic components. Now, this is the most important thing that I'm doing lately. I go to the toxicology to understand what is the toxic component in it. Scutellarin. This is a flavonoid component found in skull cap, which has been studied for its potential health benefits. However, in high doses, it may have toxic effects, particularly on the liver. Biacillin, another flavonoid in the skull cap, has been investigated for its antioxidant and anti-inflammatory properties. Okay. Central nervous system. While skull cap is often used for its sedative purpose, excessive doses may lead to depression of the central nervous system. Drowsiness, confusion. So you see now where the confusion comes from, Gaurang? It
Mhm.
comes from the toxicity, or even coma. Now these are some things which we have never investigated because we did not do provings at the level of the toxicity. So in high doses, the tincture may cause giddiness, stupor, mental confusion, twitching, irregular heartbeats, and even seizures. This is the toxicity of this remedy. Now, scutellarin have the potential to prevent and treatment of ischemic strokes as it is shown in anti-ischemic reperfusion activity. This ischemia, this elevates brain injury in acute phases by affecting the activity of the neurotransmitters in neurons. Now, understand how scutellarea as a constitution gets created. This is how Boric writes. It is a nervous sedative where nervous fear predominates. Okay. Then he writes chorea, nervous irritation, and spasms of children during dentition, twitching of muscles, and nervous weakness after influenza, which we generally use. Okay. Now, if you see the fear of anticipating night terrors, okay, this is one of the things which is the one which plays on this constitution. That may lead to either a headache, and depending on the miasmatic background, the patient may go into convulsions or chorea or whatever. Okay, that's the reason chorea has been written in capitals here. It is not come directly, because if you have to treat chorea, this nervous fear has to be the main causative factor in the patient. Now, this is from Boric. Now, if you try and understand this nervous fear, it is a worried feeling of showing uncomfortable feeling of uncertainty. And this is the most important thing, because now, as you said, in COVID, this was the most predominant feeling that was there, uncertainty. Did not know what will happen. Okay. So the nervous fear is very important. Fear of some calamity, inability to fix attention, and confusion. This is what he says as mind. So it is a sedative in a patient who are sleepless because of the nervous fear, terrors, and the fear of calamity. So the sleeplessness has to come from this particular nervous fear, because that is where the whole thing starts from. Now, if you see fear, you see all fear rubrics: fear in children, fear condition about her, fear something will happen, fear something bad will happen. All these fears are there in scutellarea. Okay, so the fear is the most important thing, and it is a nervous fear again. Okay, then you have mind, restlessness, hysterical. Okay? Let's understand how it has to be understood. What hysteria means: uncontrollable emotion, irrational from fear, emotion, or an emotional shock. This is what hysterical nervousness means. How to apply this? And causes neurasthenia. Now, what is neurasthenia? Somatic depletion, overwork because of irregular lifestyle and extended intellectual activities. That is what your lawyer was also doing, isn't it? This is what is nervous weakness. Sorry. Now, Boric writes, in sleep, night terrors, sleeplessness, sudden wakefulness, and frightful dreams. That is where I confirmed it. The moment she said, these are the kind of dreams that I get it, and these are the fears and anxieties that I went through in the headache, this is where it unites. It has to come from the night terrors. Okay. In scutellarea, the main cause is the nervous fear. The nervous irritation, and the fear of calamity, which
Would
is
you even
reflected.
consider it even without the history of post-influenza? Because that seems the keynote of the remedy.
Yes, that is the reason why I'm telling you now.
Yeah.
Because that was one way of prescribing. This is the another way where you have another perspective to it.
Right.
Now, which is reflected as headaches with chorea. So the fear will be in the predominance, fear of calamity will be there, and you will see headache with chorea. It can come to you with convulsions. Again, the cause has to be the same fear. It can come to you with twitching of muscles. It can come to you as tremors. It can come to you as eructations and hiccups. Okay, it can come to you as impotency. So these are the expressions of scutellarea where you can see. But the cause will be the nervous fear, the calamity and everything. Are you there with me? Now this is the spectrum of this remedy. The headache of scutellarea we already know. It is a dull frontal headache, night terrors, explosive, as you said, of school teachers, nervous headache, frequent urination. Okay, this is what Boric writes. So what are nervous headaches? Tension types of headaches, which indicate the role of stress and mental or emotional conflict in triggering the pain. And you will have contracting of the muscles of the neck, face, jaw. Because all those people who have nervous terror and tension, these are the places where they feel the stress more. So this is the place where they will always talk about, and these muscles, they go for contraction. and they will be having the clenching of the jaw. So generally it is right-sided, generally it is out of the fear anticipating in hysterical females triggered by the nervous fear and terrorizing dreams. This is about headaches that we already know. So this is what they write about: increase profuse urination, headache with and after action of scutellary on GIT. This is something which we had not done earlier. He writes nausea, irritations, hiccups, pain and distress, and gas, fullness, distension, colicky and uneasiness, and light colored diarrhea. If you see scutellaria, the skull cap, now this is where we generally did not use scutellaria. Scutellaria has been traditionally used as herbal medicine to support the digestive system. It is known to use in digestive patients. We have bloating of gases, bloating because of gases, anti-inflammatory to reduce inflammation in cases of IBS, antispasmodics, and gastroprotective. So at the level of physiology, it is already indicated, but this part of boric was never looked into. We only used it for headaches. Now, if you see the same cause, you can use it as a remedy for the digestive tract also. Then
So basically, you're also connecting the pharmacological dynamics and traditional
yes,
medicines and
yes, but see, a lot of
alkaloids
things.
to this to an
Yes.
extent.
So because what we used to do, scutellaria we used to use only for headache. Now, if you see, you can use it for different pathologies. Now, it works on sedatives because it is working as sedatives because it has a kind of something which we called as GABA, which inhibits neurotransmitters, and it is a part of scutellaria. It is not that scutellaria sleeplessness came on provings. It was a toxicity symptom. That's the reason it was used as a sedative. And this is how sedatives work. And this is a part of scutellaria. Okay. So this is where scutellaria comes as sedative, not because it is a proving symptom, but it is a part of the toxicological symptom. Okay. Action on extremities. This is something which we did not do earlier. The twitching of the muscles must move, chorea and tremors. Okay. If you see the toxicology, skull cap was used in nervous disorders, including hysteria, nervous tensions, and also in combination for sedative and sleeping pills. It has action on the muscles, not because I say it. It is given in the books of toxicology.
And why this is also interesting is because this is also the way Hahnemann studied, because as we know that Hahnemann had a lot of background of studying chemistry and so many different subjects, and he studied domestic medicines and he connected that. So this is what more or less you're also talking about. So this is very
That is
interesting.
what actually I want. So now instead of being connected only to the anxieties and fears, you take the miasmatic background and use the same remedy for chorea, convulsions, and night terrors. So the same remedy which comes from the night terrors, if the patient has a miasmatic background, may be used for chorea and convulsions. Okay. So if you see convulsions from repertory, you have so many rubrics which talk about convulsions, which we have never seen for scutellaria. So this is something that you can do using this. So this is how Clark writes about convulsions. Convulsions during dentition. It is a rubric we know. He has written there, but there is a connection to it. Why it happens during dentition? And Clark writes it, and it is written by Boric also. Similarly, tremors and trembling. Okay. Then similarly with irritations and twitching of the muscles. Okay. Now, this is because of scutellarin. Everything that happens is because of scutellarin. And this scutellarin has to be understood, and the sphere of action of scutellarin should be taken on every particular tract and used. So this is what I generally do by trying to understand the cause, going to the physiopathology, the toxicology, and seeing each and every symptom of that particular materia medica expressed and correlating it with the pathology. And Gaurang, I'll tell you, I found most of the remedies which we are seeing have a toxicological connection.
I'm sure.
We feel that it is a proving symptom, but they are toxicologically connected. All of these things. Otherwise, how do you see these remedies are used in tumors? Because they, in their toxicological form, created that. and that was held by the miasmatic factor. So you can use now scutellariae in digestive disorders of hysterical women, spasms and convulsions of children during dentition, or chorea of tremors, which has had a similar night terrors. Okay. So by this now, I could now see that the spectrum of the remedy has increased. Now this is a very small remedy, and this had only nervous symptoms. We have done for remedies with higher toxicity, like the remedy that you spoke about in cases of uremia, and understanding how it disturbed the nephron and how it destroyed the
And
nephron, and the same
especially
remedy can
remedies,
cure it.
especially what is interesting is especially remedies which are little lesser proved and smaller, like we
Yes,
spoke about urea, we spoke
yes,
about solidago, we spoke about,
yes.
remedies like this, Jonosia asoka. Now that is very interesting to explore. And the other thing is that the couple of books that really explain more in detail, similar to what you already spoke about it. One is Bird's Physiology, and I'll ask Dr. Srishti to write about it so our participants can read. Is Bird's Physiology, and second is actually one of my favorite books. It's called as Alexander Blackwood's Pharmacodynamics of Homeopathic Materia Medica. This is a very rare book.
Mhm.
Alexander Blackwood, Pharmacodynamics of Homeopathic Materia Medica. What Sir is talking about in similar lines, he has written, and the entire Materia Medica, every remedy. So could be an interesting addition to what uh, Dr. Gajanan is talking about. We are too much over time, sir. We have
Yes,
taken
yes,
half an
yes.
hour more. We have translators here. Extremely
Sorry, but
interesting discussion. So I wanted it to go on. Not at all. Sorry. This is so interesting, and that's why we invite colleagues like Dr. Gajanan to come and have this kind of discussion, where you don't come to know the time.
anyway, it was very
So
interesting talking to you, and it
and
was
that
good
an
you were there so that
opportunity.
we could get something different as a conversation.
I'm
And
I'm
it
looking
was
forward
really
to
interesting.
a discussion with you. I was saying I'm looking forward to a discussion with you in your approach, in especially in rheumatological cases. I think we'll have a similar discussion. Would be
Yes,
very
yes, yes.
interesting.
It would be interesting since now we have spoken about it. I'll be ready with most of the things which I do. I'd love that you should be there and we would
we,
have a nice
we
discussion. Maybe we'll have an
I think it
extended
will be
time.
very interesting.
Yeah, so all the
Yeah, we
translators
can
will be
have a
ready for an
extended
extended session.
session till midnight. Yeah.
Okay.
Yeah.
Thank you, everybody.
Perfect.
Thank you,
Perfect.
everybody
Perfect.
around the world. And thank you, Dr. Gaurang and Dr. Shrishti
Thank you,
and
Dr.
all the
Gajanan.
translators. Love you all. Thank you very much for cooperating and hope you understood. If there's anything, please write to me or Dr. Gaurang. We would again like to discuss in case there is something that you have something need as a clarity. Obrigado. Thank you.